Video, I'm going to go over substance abuse and some key features you need to know about it. Now, this is not my specialty, but unfortunately, I have a lot of people in my family with substance abuse disorders. So I feel like I do know a little bit about this disease. Now, there is a really good voiceover PowerPoint in your slides in I believe it's week 12. Um, but I made a short little Quizlet I'm going to go over with you, okay? So, the two most common defense mechanisms used by people who abuse substances are denial and rationalization. So, the way denial looks is like somebody says, "Oh, I only have one glass of wine a night," when in fact they have six. Okay, so they're in denial about how much they're drinking. And then an example of rationalization is, "Oh, I worked so hard all week. I'm going to go home and have a bottle of wine." Okay, that's an example of rationalization. Or, you say your family member um, drinks because they work so hard or something like that. So, enabling this is helping a person who abuses substance and avoid the negative consequences of their actions, like, covering for them, calling in sick for them, um, bailing them out of jail multiple times. So, and then codependency is a relationships where the non-abusing partner or family member is controlled by the abuser's behavior. So like a teenage child, the book gives, finds his father in the bar, takes him home, and does the cooking and cleaning in his house. So he's codependent. One standard drink equals 12 ounces of beer, 6 ounces of wine, or 1.5 ounce of whiskey. Those are all considered one standard drink. It takes about an hour for us to metabolize one standard drink. What you need to do, what everybody should do before they care for a patient with substance abuse disorder, is examine your own personal biases about substance abuse. Alcohol is a CNS depressant. It's very prevalent in this country. It's easy to get. It's cheap. Um, and so that's one of the reasons there's a problem in our country. When do early symptoms of alcohol withdrawal start? So for somebody that is dependent on alcohol, meaning they drink every day, and if they don't drink it, they're going to start having withdrawal symptoms. These symptoms are going to start 6 to 12 hours after the last drink. The early symptoms in this 6 to 12 hour period are going to be anxiety, irritable, and agitation. So if you have somebody that is within the 6 to 12 hours, they're going to be agitated, irritable, and anxious, okay? Now, as ETOH withdrawal progresses, their blood pressure is going to go up, their pulse is going to go up, they're going to start having tremors, nausea, and vomiting. I think of it like everything's coming out, right? Everything's going up. They could have the DTs, delirium tremens, hallucinations, and seizures, okay, which can be dangerous. So people aren't supposed to just quit alcohol, people that are dependent on it, okay? They need to be under medical care, not necessarily in a facility, but under medical care. Major withdrawal symptoms occur 2 to 3 days after the last drink and may last 3 to 5 days. How is alcohol use disorder established? The physician will look at like withdrawal symptoms. Does the patient have like impaired relationships? Do they keep drinking despite the negative consequences? That's like a definition right there in itself. The treatment for alcohol use disorder includes detoxification. Medications can be used to help prevent relapse. Group therapy. The patient can engage in support groups like smart groups, and also like AA, and self-management strategies. Detoxification. So what detoxification is we treat the patient symptomatically, like say they come in intoxicated and they need help detoxing, okay? So it's the medical management of the withdrawal from alcohol and other drugs, and we provide symptomatic relief until they basically sleep it off, or it metabolizes. The purpose of group therapy, why group therapy is so important, it helps the patient break through denial. Denial is really strong in substance abuse disorders. And when the patient can break through denial, they can start working, doing the hard work. But also group therapy, they feel their tribe, right? They meet their tribe, people just like them that can help them through this journey. Which medications are used in the detoxing treatment phase of AUD? That's alcohol use disorder. Benzos, Librium, diazepine, uh, and then vitamins like folate, folic acid, and thiamine. So if somebody has thiamine deficiency, they can get Wernicke encephalopathy if they abuse alcohol. And the signs and symptoms of this is confusion, ataxia, um, confabulation, and nystagmus. Remember, nystagmus is involuntary eye movements. And this is reversible, and the treatment is thiamine. So we give thiamine to prevent this. And you've probably seen patients in the hospital with banana bags. So that's the IV, um, bag of fluids and also vitamins that a patient would get in the hospital. Uh, Korsakoff syndrome. This is a late manifestation of Wernicke encephaly, and this is not reversible. All right. Naltrexone is an opioid antagonist. It can be given as a depot medication, meaning it's a shot that lasts 3 weeks to a month. It can be used in both alcohol use disorder, but also opioid disorder. So it can be used in both, treatment of both. It suppresses the pleasurable effects of either alcohol or opioids to help prevent relapse. The other kind of CNS depressants that are abused frequently in this country are benzodiazepines. So the treatment of benzodiazepine withdrawal, this is another drug that shouldn't be stopped abruptly, is titrated doses of the benzodiazepine. And the signs and symptoms of benzodiazepine withdrawal are the same because it's a CNS depressant as well. High blood pressure and pulse, nervousness, and anxiety. Barbiturate overdose can lead to respiratory depression, so they may need to be intubated. And then opioid overdose, actually, there's a reversal agent for that, and it's called naloxone, and it's an opiate antagonist, and it reverses opioid-induced respiratory depression. The problem is it's got a shorter half-life than the opioids. So what you need to do if you have to give somebody naloxone is you have to monitor closely because the patient may go back into respiratory depression, and then you would have to administer another dose. All right. Signs and symptoms of CNS stimulant use. People that are very hyperactive, they talk fast, they just never stop. They're all and then they crash, right? And then they could sleep for even days. Also having anorexia, not neurosis, just they don't eat. Okay. The CAGE questionnaire is used in alcohol use disorder assessment. So it stands for Have you ever felt you should cut down on drinking? That's a C. The A is Have people annoyed you by criticizing your drinking? G is Do you feel bad or guilty about your drinking? And E is Have you ever had to have an eye opener to steady your nerves? And so that's it for substance abuse disorders. Please watch, view the PowerPoint, the voiceover PowerPoint. It's done really well. And I just gave you a short synopsis here. There's about 25 questions in the fall 23 final exam on substance abuse.